In this presentation, I'm going to show you how to create a treatment plan for your patient in Eaglesoft. First place you need to go to create the treatment plan is you want to be in the patient's chart. So if you're not in the patient's chart, you're going to want to click chart on this upper ribbon. And this is going to bring you to where you're going to create the treatment plan. Now, sometimes this screen comes up. If it does, just press OK. And it's going to redirect you. You're going to see that I have already documented all the restorations within my patient. And then on the left side, you're going to start to see some x-rays that come up that are connected to my patient. And then on the right side is where we're going to select our services for the treatment that we want to render on our patient. So every treatment plan is going to create is going to have in some kind of an assessment. So on the right side, you're going to see INITL. If you click on this, you're going to see that we have two options, one for an initial assessment and then one for a recall assessment. The initial assessment is designed for patients who have never been seen at Herzing University before. The recall assessment is, I have seen this patient before, or this patient has been seen at Herzing University in the past. So I'm going to click on recall because this patient has been a long-standing patient with Herzing University. And you want to make sure that when this screen comes up that you are clicking proposed. And when you do that, the provider, your name, will show up here. Once you verify that, you're going to press OK. I'm also going to do oral hygiene instructions. So I'm going to click on OHI. I'm going to select it. I'm going to make sure proposed is clicked. My name is here, and I'm going to press OK. Then I need to create what kind of cleaning. So up here we have PRO, abbreviations for prophy. So I'm going to select it. And now it gives me the option between adolescent, adult, or child. My patient is 30 years old, so I'm going to go ahead and select the adult prophylaxis. Again, making sure that it's proposed with my name. I'm going to press OK. And during my assessment, I classified my patient as being a high caries risk, so I am going to recommend fluoride, so FL2. And then this gives me the option to select tray or varnish. I'm going to go ahead and do varnish on my patient. It's proposed, my name is here, and now I'm going to click on OK. Now, down here in the very bottom box, you are going to notice that everything that I have proposed for my patient shows up down here. And this is a great opportunity at this point to make sure that what you have treatment planned is correct, meaning making sure that the services are accurate and the cost. Now, if you look at the cost and you're like, nope, that should be a different amount, then you're going to want to go up to the front desk team and ask them to take a look into this because it's probably a preference issue that the front desk needs to change, not on your part. So it's a great time to review with what you have recommended for your patient. As long as all of this looks good, we're going to move on and we're going to create the treatment plan. So we're going to go down on this bottom ribbon where it says treatment plan. We're going to click on that. When we click on this, it is going to bring us to this. And on the right side, this area here where it says new plan. So we're going to create a new treatment plan for our patients. So we're going to select this. Now, in the description, a lot of students will just put the date. You're going to hit OK. And then what we're going to do is you're going to see a whole bunch of stuff here. And we are going to want to select only what we want. And sometimes, it's just what you want. Sometimes there's additional. Since it is a test patient, you're going to see a lot more. So we're going to go and we're going to look at the date and we're going to look at what we want to render. So I noticed that right here, I want to do recall assessment, oral hygiene. We're doing an adult cleaning and fluoride. I'm looking at the date, so I'm going to go ahead and select these services. Down here on the lower left, it's going to say use selected planned services. So I'm going to go ahead and click on that. And then right here, it's going to show all of the services that you want to put into your treatment plan. At this point, we want to present the treatment plan to our patient. So on the right side, we have this tab as presentation. We're going to go ahead and click on presentation. It will ask to save all plans. Yes, we do, and we want to continue. And now it's going to show us the presentation. It will say detailed treatment plan presentation. And this is what we want to present to our patient. We're going to show our patient the services that we want to do and how much the services are, and then what is the total plan. Make sure that this is what your patient agrees to pay. And if they don't, then we have to back up and find out with the front desk what we need to do. So my patient has agreed to do the recall assessment, the oral hygiene instructions, the adult cleaning, and the fluoride. The services are going to total $40. My patient agrees. So I'm going to go ahead and exit out of this. Now what I want to do is I am going to create the informed consent. So I'm going to go ahead and click on New Informed Consent. Yes, we want to save the plans, and yes, we want to continue. And then this is our treatment plan. Again, we have the date, the services, and now everything is proposed. And we want to create our auto note. So we're going to click on auto note, and you're going to scroll down to find something that's in blue that says informed consent narrative. You're going to click on that, and you're going to select use, which is automatically going to put in our narrative. At this point, you're going to have the patient sign. You're going to accept the signature. You as the clinician is going to sign, and then your instructor is going to sign. So you can see that you have the patient's signature, your signature as the clinician, and then your instructor's signature. All three signatures are required before you can accept and create your consent. So we have the three signatures. I'm going to accept the signature, and then I'm going to create the consent. When I do this, it's going to create the treatment plan, and it's going to put it directly into SmartDocs. So now this slide will come up. I'm going to go ahead and exit it. And I'm going to exit out of this. And it's going to say clear treatment plan. And you are going to press yes. Okay, now let's make sure that your treatment plan is in fact saved to your SmartDocs. Okay, so on the bottom ribbon, you're going to see DOC. So you can go ahead and click on that, bring it up into your SmartDocs, and then you are going to see on the left side if the treatment plan is in there. And you can see right here, it says consent for treatment plan. It has the date. So if I want to verify it, I can double click on that treatment plan, and you're going to see what the patient has signed. This lets us know that the treatment plan has been saved into the patient's chart, and now we have proof, and now we can continue with our services. And that is how you create a treatment plan for your patient in Eaglesoft.